April is Oral Health Awareness Month, and it's about our teeth, but it's about so much more. And there are options now when you want to take care of your teeth. It's not just about the dentist. How about your dental hygienist? And we are going to meet an individual dental hygienist here, who is Betty Jane Champion of Champion Dental Hygienist. It is good to have you back again.
Oh, it's great to be here.
Nice to see you again. You know, we talked last year, I think, and it was just after there had been some changes. Most of us grew up going to a dentist. Mm-hmm. You had your dentist office. You go into the office with all of the noises and the sounds and everything, the drills that we hear that make us kind of go, ooh. But you work as an individual practice as a dental hygienist. People come into your home, Betty Jane, to see you, and I can only imagine that would be a much more relaxing atmosphere for a lot of people.
Oh, totally. It's totally different, relaxing, comfortable. My backyard, the door is right there to see all my beautiful perennials, and I have a fireplace in my clinic.
Oh, take a look at that. That's beautiful. You know, it's so much more relaxed atmosphere, and for some people, you know, we're talking about stigma. There's this whole stigma that goes through our minds when we're thinking about going to the dentist. In your case, though, people come to your home, it's a relaxed atmosphere, and the work that you're doing is very similar to what you would be doing in a dentist's office. And you did work in a dental practice for years.
Oh, for 30 years, yes. And opening my own, I can do everything that a hygienist can do. This year we were authorized to be able to do temporary fillings, so when somebody does come in and they have something broken, I can help them with that for a temporary solution, but some of those temporary solutions can last for many years. So I do cleanings and polishing. I do a lot of whitening. And sealants and mouth guards and all the things that a typical dental hygienist would do, except I can take more time, do the assessment more thoroughly than in a 40-minute slot, where then the dentist will come and do the assessment. So I don't have that part of it, but I do suggest that people do have their checkup once a year or so.
Well, and if somebody comes to you and there is something a little bit bigger or that needs to be dealt with, or something that you notice when you're doing the checkup with the client, that's when you tell them, you know, this is going on and I think you should see your dentist. You need to go and have this checked into.
Yes, and I often will phone their dentist and get them an appointment. Usually if I phone, they can get in a little bit sooner than if the patient waits 2 weeks and then says, okay. A big part about oral health now is all the oral cancer. It's incredible. I think there's 5 to 7 people a year die in North America of oral cancer. Wow. It is more prevalent than the ovarian and the prostate cancer. It's way more prevalent because of the days we live in.
Well, and that's why I was going to say, you know, once upon a time we called April Dental Health Month. Now they call it Oral Health Month, right, because I think they want people to be aware it's about more than just having nice looking teeth. Your mouth really is your gateway, right, to your overall health. And we need to keep our oral health in check because it really does help keep the rest of our health, right, in check too.
Yes, there's many links now that we've found to heart health and oral health and diabetes, and there's so many diseases that those bacteria will cause situations that you have to be worse.
And if people don't go to their dentist and they're not getting the checkups for whatever reason, whether they're nervous, they don't like the appointment, they don't want to go, whatever it is, it can affect their health. And that's why, you know, to have great practices like yours, where people can feel a little more relaxed, you can take your time with them, and, you know, if there are those questions, those reasons that they're just a little bit nervous, you can set them down and make sure that they're getting the checkups that they need.
That's right. That's right. It was in 2007 that the government authorized hygienists to have standalone clinics, and I think it was a very wise decision. It gave a lot of people a more affordable option, a more accessible option. I remember at the last dentist I worked for, when you called in, you could get an appointment in 2 or 3 months. Whereas generally I'll leave some time aside that if somebody needs me next week, then I've got some time to fit them in before some wedding or whatever they are needing that for.
Well, I want to talk about something that you already mentioned is really a big one in your practice, and that's the teeth whitening.
Yes.
A lot of people are wondering about the teeth whitening, and this is something that you offer at your practice as well.
Oh, I do. The system that I use is called Spa Dent, and it is the only whitening in Canada that has a natural health product number.
Really?
Yeah, it has a lot of great ingredients in it. It's got neem and aloe and xylitol and mint, a lot of things that will counteract any sensitivity. So this product is virtually sensitivity free, which is awesome because that's what people are scared of. A lady actually called me this morning and she said, I paid $600 for a whitening and my teeth have never stopped being sensitive. It's activated by an LED light as opposed to UV, which UV can cause a lot of sensitivity because it dehydrates things.
Okay. And you actually have a home Spa Dent kit
Right.
that's available. And this is it. I was expecting this machine when you came in, Betty Jane, to see it. This is it. That's as big as it is. So how does this work?
There's a gel that comes with it that you place the gel inside the tray. And then I'll let Susan just turn that little button. You place it in your mouth. And then there's a little...
Oh, look at that. You can see, I'm going to hold it down so it's by the chair so that you can see the difference. The light goes on. That's the UV light.
Yes. And so many systems that the dentist will send you home with are an hour or two or overnight. This can be worn for 20 minutes a day for 7 to 10 days, and you will go up probably 4 to 6 shades in whitening.
That's amazing. And you can find out more at Champion Dental Hygiene. Information was all up there for you, and contact Betty Jane and have a white teeth and healthy smile too. Thank you for joining us.
Oh, thank you for having me.
More daytime still to come. Stay with us.